You know the upper limb MSK exam? It can feel like this massive, scary checklist, right? But what if I told you there's a way to make it a confident, smooth, and logical process every single time? Well, that's exactly what we're going to break down in this explainer. We're going to take all that complexity and make it crystal clear.
All right, let's get into it. Here's our game plan. We've got a simple 5-step roadmap. It's going to guide us from the second you walk in the door all the way through the exam itself and right up to the point where you present your findings like you've been doing it for years.
Okay, first things first, the entrance. You can win or lose a clinical encounter in that first minute. Seriously, it all happens before you even touch the patient, so it's absolutely crucial we nail these opening moments. So, what do you do in those first 60 seconds? It's all about setting the tone, professional, but also building that trust, that rapport. You walk in, greet the examiner, then turn your attention to the patient and their family. Then, and this is key, you explain exactly what you're going to do and get their okay to start. Look, this isn't just about being polite. These are the building blocks for the entire exam.
And get this, while you're doing all that talking, your brain is already working. Your assessment has started. You're doing a quick visual scan using this handy mnemonic called the 4 Ds. First up is D for dysmorphism, anything unusual about their features. Then, D for distress, do they look like they're in pain? Next, D for dimensions, what's their general size and shape? And finally, D for devices, wheelchair, a cane, anything like that. It's a super fast but super powerful way to gather a ton of info right off the bat.
Here's a really neat trick. A simple question can totally change the game and start focusing your exam right away. Just ask something like, hey, do you have any pain when you do everyday stuff like combing your hair, putting on a shirt, or even just climbing some stairs? The answer to that one question can give you so many clues before you even begin the physical part.
All right, so let's say that screening question didn't raise any major red flags. Now we get to the heart of the matter, the general examination. And for this, we're going to use that classic, super effective framework, look, feel, move. It's our guide for the whole thing.
First up, look. And we start with a really simple but smart move. You're going to ask the patient to copy you, to mirror your arm position. Just hold them out straight. Instantly, right there, you get a fantastic look at the symmetry, the length of their limbs. It's a perfect starting point.
Okay, so their arms are out. Now is your chance to do a really detailed scan with your eyes. You're looking for anything and everything on the skin. We're talking bruises, old scars, any rashes. You're also looking for swelling, anything that screams inflammation in the joints. And a pro tip, don't just look at the front. You've got to check the back of the arms too. It's just as important.
All right, we've looked. Now it's time to feel. And the number one rule here is comparison. Always compare one side to the other. You're not just feeling one shoulder, you're feeling both, either at the same time or one right after the other. What are you looking for? Any difference at all. Is one warmer? Is one more tender? That comparison is everything.
And how you do it matters. You want to use the back of your hand, the dorsum, because it's way more sensitive to temperature. So you're going to use it to feel for any heat over the joints. You start up at the shoulder and then just work your way down, methodically. Feel the shoulder, the muscles, the bones of the arm, down to the elbow, and so on. It's a system. So we've looked, we've felt. What's next? You guessed it, move. Now we get the patient involved. This is an active screening test. You're going to guide them through a few key movements that'll give us a really good idea of how all those major joints in the upper limb are working.
And this whole sequence is super quick and efficient. For the hands, you have them make a fist, then spread their fingers out like a star. For the wrists, you do the classic prayer sign and then the reverse prayer sign. That covers flexion and extension beautifully. Elbows, simple bend and straighten. And for the shoulders, you'll have them put their hands behind their neck, then behind their back, and then raise their arms all the way up. Boom! You've just screened the whole upper limb's range of motion.
Okay, but what if you find something? Let's say during that feel part, you notice one elbow is warm and swollen. Well, now everything changes. This is where we pivot from our general screen to a much more focused examination.
This is a huge mental shift. You're going from casting a wide net to using a microscope. You're going to do a deep dive on that one problem joint. But, and this is so important, you're also going to examine the joint above it and the joint below it. Always.
We're still using our look, feel, move framework, but now we're dialing up the detail to 11. For look, you might actually get out a measuring tape to see just how swollen it is. For feel, you're not just noting tenderness, you're finding the exact spot that hurts. And for move, you're testing every possible movement, flexion, extension, rotation, the whole shebang, to figure out exactly where the problem is.
Honestly, this next part is what separates the good clinicians from the great ones. If the elbow's the problem, you have to do a full range of motion exam on the shoulder and the wrist too. Why? Because it shows you're thinking bigger. You're thinking about things like referred pain, about how everything in the arm is connected. It's next level thinking. Okay, we're not done yet. A really fantastic exam doesn't just stop at the arm. It can't exist in a bubble. You have to prove to the examiner that you're not just seeing an arm, you're seeing a whole person.
This is where you become a detective and connect the dots. You have to ask yourself, could this joint pain be a sign of something bigger, a systemic problem? So you check their back. You look at their eyes for any redness. You check inside their mouth. You feel their abdomen. You're on the hunt for clues that could point to a much bigger picture.
And finally, the grand finale. Let's pull it all together. Because look, this whole process, it's not just a checklist you're running through. The real goal is to build a story, a clear, coherent clinical story. There's a great quote from our source that just nails it. It says, "You are collecting data and presenting your case and doing good clinical reasoning." That's it, right there. Every single thing you do, every observation, every test, it's a piece of data. And your job is to put all those pieces together to present a logical case that shows off your awesome clinical thinking.
So as you start practicing this routine, I want you to keep one question in your head. How does this build my clinical story? Because when you start thinking that way, the exam stops being just a boring procedure. It transforms into this powerful diagnostic tool. You're not just following a script anymore. You're solving a mystery.